every day, saving lives.
And it looks like our aerials have been cut, and now we have a live view at a Bernie Sanders event in Emeryville.
And in order for you to do your jobs in the way you were trained and want to do your jobs, we need radical transformation of the American healthcare system.
Yeah, you're right.
And you know that you cannot keep America healthy if people cannot go to a doctor or a nurse when they need to.
Yes, right.
And you know that tens of thousands of people every single year are dying because they do not have access to health care. And what you are doing above and beyond the hard work you do every day, you are standing up and fighting and demanding that every American has health care as a right, not a privilege. I'm going to say a few words in a moment, but I wanted to introduce some people who, on a daily basis, are working amidst the healthcare crisis in this country, and I want them to reflect on what they see and where they want this country and the state to go. And let me begin by thanking Dr. Bill Honigman, who is an emergency room physician who is working in the midst of the health crisis every day. Bill, come on up.
Thank you. Thanks, everyone, for being here. I'm Bill Honigman from Orange County. I'm a practicing physician specializing in and board certified in emergency medicine. I'm also a longtime Democratic Party activist and an organizer with the grassroots group Progressive Democrats of America, PDA. Among the critical issues facing America, access to quality health care remains a top priority for everyone in this country. Preventable deaths and such indicators as infant and maternal mortality rates have only been partially mitigated since the Affordable Care Act. More than 1 million U.S. households, even now, are expected to declare bankruptcy annually due to personal health care costs. And studies predict about 75% of those households will have had health insurance at a time it failed them at a time when they needed it. Bernie Sanders understands, as do the rest of us in the movement, that a single-payer, expanded and improved Medicare for All system would save money, not cost more, and save lives.
Yes.
It's the bold move forward that's needed toward resolving this crisis. As President of the United States, Bernie Sanders will continue leading toward this end, not just from Washington, D.C., but in cities and communities from coast to coast, in the massive involvement of all those affected, meaning all of us. In fact, the political revolution that Senator Sanders often describes is exactly what would be needed to transition from the current profit-driven consumer model of healthcare delivery to the just system that we need to ensure that everyone is provided for and nobody is left out. Emergency room physician, I just want to say I see those affected by the crisis every day. I see people who fall through the cracks, who can't get to see a doctor, who refuse care, can't see a dentist, and end up settling for the most expensive, most inefficient, and desperate measures that can be offered in the emergency room. I know, based on this personal experience, as well as the published information on American healthcare, that Bernie Sanders is exactly the leader and the president we need to bring about this change. Thank you.
Now gives me a great deal of pleasure to introduce Deborah Berger, who is the co-president of National Nurses United. Deborah?
Good morning, everyone. As you know, I'm president of National Nurses United and the California Nurses Association. And it's always a good thing when National Nurses United and Bernie Sanders share a platform, because it reminds us of how much we share in common. Over many years, we have organized together for a people's agenda based on our shared values of caring, compassion, and community. For nurses, that means standing up with your patients to demand guaranteed health care for all. And Bernie Sanders stands for that same principle. Health care is a human right. Each patient deserves the health care they need rather than receiving only health care they can afford. Bernie Sanders understands the anguish of our patients who can't go to the doctor or who are sent home without the help they need after a hospital stay, or who pay higher and higher costs, have limited choice of providers, and huge prescription drug bills. Nurses see patients return to the hospital because they had to split their pills in half or didn't even fill the prescription because they couldn't afford the high cost of the drug. We see families bankrupted because their child confronts cancer, and we know it doesn't have to be this way. We know that. So does Bernie Sanders. He gets the human impact of our patients' delayed treatments and denied care, and he does something about it. Bernie Sanders won $11 billion for community clinics in the Affordable Care Act, a signature. This significantly expanded access to care for poor and working class families, and it was Bernie Sanders who wrangled with the GOP majority to secure $15 billion more for our veterans' health care. During the health care fight, he also was leading in the Senate to make sure that there was guaranteed health care through a single-payer, improved Medicare for all system, and he won't give up on that fight. Nurses know we cannot provide care for the patients we need, and we know who to hold accountable, and that is the insurance industry and the big drug companies. Yes. Leading in Congress, joining with us and with our patients in that effort, has been Senator Bernie Sanders. Bernie Sanders stands with us on safe staffing in our hospitals, advocating for the number of patients assigned to each nurse, and for utilizing the clinical judgment of nurses and doctors to make healthcare decisions rather than the bean counters in the healthcare industry. Bernie's plan to expand and improve Medicare for all would enable nurses to provide the care for our patients in need, as it saves money by eliminating waste and redirecting spending and profits back to patient care where it should have been all along. So it's really easy for nurses to say to voters, Bernie Sanders would dramatically improve the health of the United States. Yes. Nurses proudly stand with Senator Bernie Sanders to demand that we guarantee health care for all as a human right. Yes. Yes. So sisters and brothers, members of the media, it is my honor to be here today to work with Senator Sanders to take back our country and make sure that we do guarantee health care as a human right. And I just want to say thank you to Senator Sanders, who is the next president of the United States.
From our third speaker, Dr. Hank Abrams, who is the board president of Physicians for a National Health Care Program.
Thank you. For decades, our country has been locked into an exorbitantly expensive yet wasteful healthcare system, a system that fails to provide access to any care at all for millions and leaves even more folks sacrificing their savings to get care that is often delayed. As you have heard, everybody acknowledges this, but only one candidate has a plan that can gain our legitimate right to health care, a plan that's medically much more effective and economically much more responsive than what exists now. 25 years ago, the Journal of the American Medical Association published an article describing a national health program that, quote, would cover all Americans under a single comprehensive public insurance program without co-payments or deductibles and with free choice of provider, end of quote. Some call it single payer, but often it's just called improved Medicare for all. Most folks say they want it, and most doctors say we need it, and nurses, there's no question what they say. So why don't we have it? I'll tell you why. Because special interests have put a stranglehold on legislation to reform health care. That's not fair. In fact, it's un-American. Senator Sanders wants to change that, to restore control of health care to patients and their doctors and nurses and other caregivers by breaking the stranglehold of giant corporations and enacting an improved Medicare for all. Don't be fooled by other candidates who propose fiddling with the current system when it's clear that it can't be fixed. Be smart. Vote for Bernie and candidates for Congress and the state legislature who are committed to fighting for improved Medicare for all. And I hope my medical colleagues, family, friends, and neighbors will join me in voting for Bernie so we can finally fix our broken health care system.
Let me thank Bill and Deborah and Hank, not only for the work they do every day to keep us healthy, but for their understanding that if they and all of you are going to do your jobs well, we need to guarantee health care to all people as a right. Now, let's take a look at what in fact is going on in America and what is going on in the world. Embarrassingly, the United States today is the only major country on earth, the only one, that does not guarantee health care to all people as a right. You go to Europe, you go to Scandinavia. I live 50 miles away from Canada. Health care is a right for all people.
Yeah, you're right.
Now, I worked on the Affordable Care Act, and I think it has made some significant improvements. But clearly, it has not gone far enough. Right. How can we be satisfied when 28 million people in this country today have zero health insurance?
Shameful.
How can we be satisfied when even more, and that number is growing every day, are underinsured with high deductibles and high copayments?
Right.
So what does it mean in America if you have no health insurance or if you are underinsured? Here is what it means. It means that when you get sick, you may not go to the doctor or nurse to get the care that you need. And what happens if you don't go and get the medical care that you need? You get sicker. And sometimes you die as a result of that. I have talked to doctors and nurses in Vermont and all over this country. And what they tell me is people walk into their offices much sicker than they should be if they went for medical care when they needed it. So our job is to say that if you're sick, go to the doctor, go to the nurse, get the medical care you need when you need it. Don't wait a year. And sometimes when you walk in, the doctor or nurse will say, it's too late. It's too late. Your situation is terminal. That is inhumane, that is insane, and that is not what should be happening in America. And by the way, the result of is that some 40,000 people a year die unnecessarily because they're getting the medical care too late because they're underinsured or they have no health insurance.
Right.
40,000 people a year. Now, somebody may say, well, you know, Bernie, you're right, that's terrible, but at least we run a cost-effective healthcare system. You know, if you're not spending a lot of money, you're going to have problems.
Double speak.
We are spending far, far more per capita on healthcare than the people of any other nation. In the United Kingdom, where everybody has healthcare as a right, we are spending almost 3 times as much as they spend in the UK. We spend 50% more than the French spend. Everybody has healthcare there. And we spend significantly more than we do in Canada, where everybody has healthcare. Now, on top of the healthcare crisis, but part of it, is the crisis in the cost of prescription drugs. Okay? Now, you want to talk about crazy, and we can go on in talking about crazy and dysfunctionality in the American healthcare system. Think about this one. 1 out of 5 people who walks into a doctor's office and gets a prescription cannot afford to fill that prescription. Now, how insane is that? You get a diagnosis, and you can't take the medicine that you need in order to treat your illness. All over this country, and I've talked to these seniors in Vermont, elderly people are cutting their prescription drugs in half because they cannot afford the medicine they need. Meanwhile, if we talk about crazy, last year the top 5 drug companies who charge us the highest prices in the world, millions of people in one way or another get their medicine from Canada because the cost of medicine in Canada is substantially lower. That's crazy. But what is equally crazy is last year, the top 5 drug companies made $50 billion in profits. Yes. You want to hear crazy? This is just a partial list. I don't want to go on forever. Between Hank McKinnell Jr. was Pfizer's CEO from 2001 to 2006. Pfizer, one of the large drug companies in this country. He received a golden parachute when he left Pfizer, worth an estimated $188 million. Okay? People cannot afford the medicine they need. 5 major drug companies made $50 billion in profits last year, and 10 years ago, a guy who works for Pfizer receives a $188 million golden parachute. Frank Hassan, the CEO of Merck, from 2003 to 2009, received a golden parachute worth an estimated $189 million.
Criminal.
It is criminal. It really is criminal because what do we say if somebody dies or gets much sicker than he or she should be because they cannot afford the medicine they need? What do you say about that? It is punishing somebody. It is hurting somebody. I think it is criminal. I think it is criminal, and that's why all of us and all of you are fighting to make sure that every American gets the health care, comprehensive health care that he or she needs. And by the way, when we do that, we save middle-class families substantial sums of money because we have the most wasteful, dysfunctional system in the world. There are studies out there, the numbers go up and down, but there are studies out there that if somebody goes into, for example today, a community health center, the cost of that person going in for treatment is 1/10 the price. 1/10 the price they're going in to Bill's emergency room. And yet, how many millions of people now have no other access to health care but going to an emergency room, which is the most expensive primary health care in the country? So we've got a dysfunctional system, and we are going to change that system. That is what the American people want. We are going to take on the private insurance companies. We are going to take on the drug companies. The function of health care in a democratic, civilized society is to provide quality care to all of our people in a cost-effective way, not to make billions of dollars in profits from the drug companies or the insurance companies or golden parachutes of $180 million for some CEO of a drug company. Thank you all very much.